Hi everyone, welcome to my channel. As you can see, I got my bestie Milo with me. He's looking around like, what's going on? Today I'm going to be just making a little educational video about neuroendocrine tumors by telling you what my experience was like from diagnosis to treatment. So if you are interested in that, let's just get straight into the video. Start this video off by saying that I am not a medical professional. I am not a doctor. I am a public health student, but that does not make me qualified to treat you or give you any advice on what decisions you should make for your health. So I just want to start this video off by saying that this video is for educational purposes only, by sharing with you my story and a little information about neuroendocrine tumors that I personally know. Any information that I mention here is coming from the National Institute of Health as far as the facts go. So yeah, let's get right into it. So in January of this year, we're in 2021, I was diagnosed with a neuroendocrine tumor. And the way that I found this out is, well, let's start off by saying I completely skipped this. What is a neuroendocrine tumor? A neuroendocrine tumor, according to the National Institutes of Health, is a rare type of tumor that arises from specialized body cells called neuroendocrine cells. These cells have traits of both nerve cells and hormone-producing cells and release hormones into the blood in response to signals from the nervous system. So that is what I was diagnosed with. Now, how did I get diagnosed with this, you ask? Well, you didn't ask, but here's the answer. I have a disease called Crohn's disease. This is pretty much the only way that I found this out. I was 25 at the time. I'm 26 now. Neuroendocrine tumors are extremely rare. They're not common at all, especially in people my age, in my age range. And so this wasn't something that anyone was looking for. I was having a colonoscopy, which is where you go to sleep. They put you to sleep. They put a scope up your butt. They look for some inflammation, right? I have some more information on my experience with Crohn's disease, and I will link those videos below if you're interested in learning more about that. However, I was having the colonoscopy to look for inflammation, with my disease, to treat my disease, etc. And yes, they found inflammation, but they also found a polyp. Gastroenterologist said, all right, I biopsied the polyp. We're going to send it to the lab to see what it is. And I had to anxiously wait for a few weeks. Well, it probably was a week, but it felt like a few weeks. And got those results back, and it did come back as a neuroendocrine tumor. This tumor was actually found in my rectum. So the most common places are the digestive tract, the pancreas, rectum, lungs, or appendix. So those are the most common places. They can also be found in other organs of your body, but that's where it's most commonly found. They can either be non-cancerous, which means it's a benign tumor, or cancerous, where it has metastasized or spread to other organs of your body. I don't have any particular symptoms or signs that I can say this was directly the tumor, because I was in the middle of a flare-up for a long time at the end of 2020. And so I was just getting my procedure done to see exactly what was going on in my colon. Was there any damage, etc. If the tumor is producing hormones, and if it has spread to other organs, sometimes people will experience symptoms. It really just depends on where potentially it has spread, or what, if it's producing hormones, and its location. So it really depends on a lot of factors what you may experience potentially. I recently watched someone's story where this person was experiencing quite a few symptoms, and this person was also young, and they did end up finding out that they had a neuroendocrine tumor, and unfortunately it had spread and stuff like that. But I can't say exactly, you might experience this, because it depends on so many different factors. People are typically diagnosed with this on a procedure where they're looking for something else. So maybe you're getting your colonoscopy for the first time and you're in your 50s, and that's how they found it. It's typically not found because a lot of times there are no symptoms. You live with it. It's typically a slow growing tumor. Research has shown that many people just kind of live with them, never even really realize that they have them. And on the flip side, there are others who obviously it has spread, and unfortunately they have to live with that and manage it. So let's get into treatment. So for me personally, I had two options. I either was going to have a surgery, which I will put the name here. So I was going to either do that surgery or do a flexible sigmoidoscopy, which is just like a colonoscopy. They go up, but the sole purpose is to just remove the tumor. So we ended up going with the second option. We did the flexible sigmoidoscopy, and my gastroenterologist explained that, you know, he was going to try to remove everything. If he looked at it and was like, all right, there's more here, or something like that, I would have needed to then start seeing a colorectal surgeon who would be able to advise me what would be the best way to go about it at that point. What would be my surgery options if I needed to. Fortunately, he was able to remove everything that, you know, he saw. He didn't see that it was any deeper. It was just in the submucosa, just like the first layer and everything. So good in that area. And also, the next thing that I needed to go through was to test the tissues around the tumor. So he sent those to the lab, samples to the lab to see, was it going to have either positive margins or negative margins. You want negative margins, which just means there are no cancer cells. There's nothing additional growing. Positive margins would say, okay, now you have to see a colorectal surgeon, basically, because now we have to actually perform a surgery to remove this tissue or discuss treatment options, whether it's, I don't know, radiation or and things like that. So at that point, you would then go to, you know, see a colorectal surgeon. I also want to put this out there. A lot of regular doctors do not have a lot of information typically on neuroendocrine tumors because that's not their area of specialty. So you may have to actually look for a specialist or someone who does have knowledge with that. You know, many doctors, I saw someone's story where the doctor said they only had like one patient who ever had a neuroendocrine tumor. So like I said, it's really rare. Definitely want to be talking to someone who knows more about it if you can. So and is it life-threatening? I've seen that question on Google, you know, when I was doing my own research, and the answer is most of the time, you know, research has shown that these are, you know, people live with them. They're slow-growing tumors, slow-growing. Some places just refer to them as slow-growing cancers. It really just depends on if it's something that you're able to remove or if it has spread, and then if you need to do treatment to shrink the tumors, etc. It really just depends on how far along you are in the growth of that tumor, etc. But for the most part, it really just looks like slow-growing, benign tumors for the most part. Not that that's all 100% what happens, but, you know, from what I researched, it just looks like that's what happens most of the time. And in my case, I'm super grateful that we were able to remove everything. At the time, I was super concerned about spread, and my doctor told me he thought that was very unlikely. We did do a MRI, and it did not show any spread. So I've been super grateful for that. Yeah, that's pretty much my experience. I feel like I ended the video abruptly, but that's where my knowledge extends. I don't have any more knowledge. Like I said, I'm not a doctor. So that is from my personal experience. It was a quick diagnosis. It was a quick removal. I did not have to do any further treatment, and I did not need to have a surgery, thankfully. And yeah, so that's where we are right now. It's something that, you know, I do still have in the back of my mind, but because I get colonoscopies quite regularly and other testing, I feel confident that we would be able to find something if anything were to show up. I really hope that you enjoyed learning more about neuroendocrine tumors and what my experience was like. It definitely was nerve-wracking. I definitely was scared. I was afraid to be diagnosed with cancer and have to go through like treatments. And, you know, when you're faced with something, you just have to take it head on, you know? So if that was the case, I would have had to deal with it. But I'm happy to say that, you know, was not the case for me. And unfortunately, some people cannot say that. And please let me know in the comments, do you have any experience with neuroendocrine tumors or any tumor, what your experience was like? How long did it take you to get diagnosed? Did you have any symptoms? You know, in my case, I didn't. So I'd be interested to hear if you experienced any symptoms and what your treatment was like, etc. So yeah, hopefully you guys stick around. Maybe hit that like and subscribe button if you enjoyed this video. I hope to see you guys in a future video. Thank you so much for watching. Bye.